Are you or a loved one considering treatment for ADHD or binge eating disorder? Understanding your medication is crucial. Today, we delve into Arynta, an important medication that requires careful consideration and adherence to medical guidance. Arynta, pronounced Arynta, is the brand name for Lisdexamfetamine dimesylate, an oral solution taken once daily in the morning. It belongs to a class of medications known as central nervous system, or CNS, stimulants. Arynta is prescribed to treat attention deficit hyperactivity disorder, ADHD, in adults and children age 6 and older. It is also approved for the treatment of moderate to severe binge eating disorder, BED, in adults. The exact way Arynta works isn't fully understood. However, once ingested, its active ingredient, lisdexamfetamine, converts into dexamphetamine. This substance then acts in the brain by blocking the reuptake of dopamine and norepinephrine. This action increases the levels of these neurotransmitters in the prefrontal cortex, which can improve executive function, attention, and impulse control. It is vital to understand that Arynta is a federally controlled substance, classified as CII. This classification is due to its active ingredient, lisdexamfetamine dimesylate, which can be a target for abuse. Misuse of prescription medicines like Arynta can lead to serious health consequences. Always keep Arynta in a secure place to prevent theft or unauthorized access. Never, under any circumstances, give your Arynta to anyone else. Doing so can cause severe harm or even death to that individual. Sharing or selling Arynta is not only dangerous, but also illegal. Arynta received FDA approval on June 16, 2025, building on the established approval of lisdexamfetamine since 2007. For ADHD, Arynta helps increase attention and decrease impulsiveness and hyperactivity. For BED, it helps reduce the number of binge eating days. It is important to note specific limitations for Arynta. It is not approved for use in children under 6 years of age with ADHD. Furthermore, Arynta is not intended for weight loss, and its safety and effectiveness for treating obesity are not known. Its use in children with BED has also not been established. Like all medications, Arynta can cause side effects. The most common side effects for ADHD patients include loss of appetite, decreased appetite, diarrhea, and dry mouth. Other common effects are trouble sleeping, stomach pain, anxiety, weight loss, dizziness, irritability, nausea, and vomiting. For BED patients, common side effects include dry mouth, decreased appetite, constipation, anxiety, and trouble sleeping. Increased heart rate and feeling jittery are also frequently reported. It is important to discuss any side effects you experience with your healthcare provider. Arynta carries a boxed warning, the FDA's strongest warning, regarding its potential for abuse, misuse, and addiction. Misuse of Arynta or other amphetamine-containing medicines can lead to overdose and death. This risk increases with higher doses or unapproved methods of use, such as snorting or injection. Your healthcare provider will assess your risk for abuse before and during treatment. Arynta may also lead to physical dependence with prolonged use, even when taken as directed. Always inform your healthcare provider if you have a history of substance abuse. Proper disposal of unused medication is crucial to prevent misuse. Serious heart problems are a significant concern. Sudden death has occurred in individuals with heart defects or other serious heart conditions taking similar medications. Your healthcare provider must thoroughly check for heart problems before starting Arynta. Report any signs of heart issues like chest pain, shortness of breath, or fainting immediately. Arynta can also increase blood pressure and heart rate, requiring regular monitoring by your healthcare provider. Mental health problems are another serious consideration. These can include new or worsening behavioral issues, bipolar illness, or new psychotic symptoms like hallucinations or delusions. Inform your healthcare provider about any existing mental health conditions or a family history of suicide, bipolar illness, or depression. Seek immediate medical attention if you experience any new or worsening mental symptoms while on Arynta. In children, Arynta can slow growth, affecting both height and weight. Regular monitoring of your child's growth is essential, and treatment may be stopped if expected growth is not observed. Circulation problems in fingers and toes, known as Raynaud's phenomenon, can also occur. Symptoms include numbness, coolness, pain, or color changes in the digits. Report these symptoms to your doctor and seek immediate care for any unexplained wounds on fingers or toes. A potentially life-threatening condition called serotonin syndrome can occur if Arynta is taken with certain other medications. Symptoms include agitation, fast heartbeat, sweating, confusion, and muscle twitching. If these symptoms appear, stop taking Arynta and seek emergency medical attention immediately. New or worsening tics or Tourette syndrome can also develop or worsen during treatment. Always inform your healthcare provider about any such changes. Do not take Arynta if you are allergic to amphetamine products or any of its ingredients. It is also contraindicated if you are currently taking or have taken within the last 14 days a monoamine oxidase inhibitor, MAOI. Additionally, avoid Arynta if you are being treated with the antibiotic linezolid or intravenous methylene blue. Before starting Arynta, provide your healthcare provider with a complete medical history. This includes any heart problems, high blood pressure, or a family history of sudden death or heart rhythm issues. Disclose any mental health conditions, including psychosis, mania, bipolar illness, or depression, or a family history of these conditions. Inform your doctor about circulation problems, kidney issues, or a history of tics or Tourette syndrome. If you are pregnant, planning to become pregnant, or breastfeeding, discuss this with your healthcare provider. Arynta may harm an unborn baby and passes into breast milk, so breastfeeding is not recommended during treatment. A pregnancy registry is available for women exposed to Arynta during pregnancy. Always take Arynta exactly as prescribed by your healthcare provider. Refer to the detailed instructions for use provided with your medication. Your doctor may adjust your dose as needed. Arynta is an oral solution taken once daily, preferably in the morning, with or without food. Taking it in the afternoon may cause trouble sleeping. If you or your child accidentally take too much Arynta, contact your healthcare provider or the poison helpline immediately, or go to the nearest hospital emergency room. Before starting treatment, your doctor will assess for any cardiac disease. Dosing adjustments may be necessary for individuals with severe kidney impairment or end-stage renal disease. For ADHD in adults and children 6 years and older, the initial dose is typically 30 milligrams every morning, with weekly titrations of 10 milligrams or 20 milligrams. The recommended dose ranges from 30 milligrams to 70 milligrams per day, with a maximum dose of 70 milligrams per day. For BED in adults, the initial dose is also 30 milligrams every morning, with weekly titrations of 20 milligrams. The recommended dose is 50 milligrams to 70 milligrams per day, with a maximum of 70 milligrams per day.